Now I'm doing an environmental scan of the room. My name is Omolola. I'm an Ontario Tech student. Hi, my name is Omolola and I'm from Ontario Tech. I am here to do my Ethical assessment. Please, can I have your consent to record this video? Yes. And also, I'll be auscultating and I'll be puppeting. Do I have your consent to touch you?
Yes.
Okay. Before I do any ethical, the first thing I have to do is I have to check my environmental scan. I have to check that the oxygen is working, functioning well, and is in nasal prom, and the connecting tubes are present in the patient's room. The suctioning, the tube, and is functioning, and also the younger is within the bedside. The call bell is within the patient's reach. The side bed rails are up, and the bed is in the lowest position. Then now, after that, I need to be sure I am with the right patient. How do I do that? I have my sheet here, and I'm going to confirm with the handband of the patient, the name and the date of birth to be sure I am with my patient. The next thing I have to do is, you already giving me consent already. So my patient, the general survey, she's sitting down in high filer's position. Her face is relaxed. Her face is calm. She's breathing regularly. There is absence of any distress, any cyanosis, any pallor. The color of her skin is normal for her ethnicity. Please, madam, can you tell me what brings you in here today?
I have a headache.
What makes it worse? What makes it better?
Worse is just like doing any activity, it makes it worse. And when I take Tylenol, it gets better.
Okay. Can you describe the pain?
So like a throbbing pain.
Okay. Do you know what caused this pain?
I think it's stress.
Okay.
With work.
Okay. When did this pain start?
It started about 2 days ago.
Can you tell me where the location of the pain, where it is coming from?
It's like around this area, front area.
Okay. Between the scale of 0 to 10, 0 being no pain, 10 means the worst pain. Can you rate your pain?
It's about a 5.
Okay. Okay. Don't worry, I won't be touching your head. I'm just verbalizing all what I'm doing. Now, assessing, I've checked your vital signs and I'm going to verbalizing it. The normal values for an adult vital signs. Starting with the temperature, the range starts from 36.5 to 37.5. My patient right now's temperature is 36.8, which is good. The respiratory rate normal is from 12 to 20. Ours is 14, which is good. The pulse normal value is 60 to 100. A value is 70, which is good. The oxygen range, saturation range is from 95 to 100. Ours is 98, which is good. And blood pressure, the range is 120 over 80. Ours is 120 over 75, which is good. So we're fine. Please, can you tell me your name?
My name is Yewande Fale.
Do you know where you are?
Yes, I'm in Oshawa.
Do you know what year we are in?
April 2025, April 14th.
My patient is alert and narrated times 3 to person, place, and time. I am going to be accessing your pupil. I'm mimicking this as a pen light. I forgot to take my pen light. Please pardon me. So now I'm checking the direct response and the consensual response. So with each people, I'm putting my pen in the right people. I'm checking for the direct response. Our people is constricting. Now looking at the indirect response, it is converging. So now I'm also using the left pupil. The pupil is constricting and reacting. Then now what next thing I'm going to do is I'm going to be putting this pen closer to you. Just look at this pen. Looking at the two pupils, they are converging and they are reacting. So I will say that the two pupils are accommodating. So my patient pupil assessment, eye assessment, it is equal bilaterally, they are round, it is constricting, it is reacting, and it is accommodating. So if the pupil is constricting and converging, that means that they are both accommodating. When I put it, I notice they are constricting and they are converging. That means it is accommodating. So now I'm going to be checking upper extremities. So what I'm going to be doing is inspection. In inspecting the upper extremities, the color of the skin is normal for our ethnicity. There are no edema. See? No edema. Then now I'm going to be palpating. Starting with the temperature, I'm going to put my back of my hands to palpate for the temperature. The temperature is warm and dry bilaterally. I'm going to be palpating your radial pulse to check pulse. They're strong. Then the brachial pulse too. Yeah, they're strong. The next thing I'm going to be doing is hold my hands to squeeze it. Yeah, she has a muscle strength that is strong bilaterally. Then I'll be checking your capillary refill. Capillary refill. They came less than 2 seconds. So now the next thing I'm going to be doing, I'm going to be inspecting a chest. A chest is elliptical, it is sloping downward. It is symmetrical. The anterior and the posterior diameter transverse is 1 to 2. The quality of respiration is calm, it is regular, and it is good. Now what I'm going to be doing is I'm palpating for tenderness and masses. Palpating for tenderness and masses. In a hospital setting, I will remove the cloth of my patient. But because of privacy purpose, she's putting on a shirt and this is going to be uploaded on YouTube. I don't want to remove her clothes. So now there are no tenderness, no masses. The next thing I have to do is I have to auscultate with my stethoscope, starting from the left side. And I'm going to work my way down to the right side for a full inspiratory and expiratory breath. So can you breathe in and out for me? Using the 5-point sequence. And I'm using the Z-track method. So during auscultation, I noticed that there is a good air entry bilaterally. There are no adventitious sounds. And also there is no wheezing, there is no crackles, and there is absence of any stridor. Now, if my patient is on oxygen, I am going to check the oxygen rate. Also, in the chest, there is absence of any dressing. There is no tracheostomy. If there is tracheostomy, I would change the dressing. Because most of the time, the tracheostomy should have mucus. I will suction and change the dressing. The next thing I'm doing right now is I'm inspecting the pericardium. I'm inspecting for the color. I'm checking the color of the skin is normal for ethnicity. There are no dressing. And also, now I'm going to be auscultating for the sound. I'm going to start with my second intercostal area at the right of the sternum border. Right? Then I'm going to walk myself down. So I'll be doing this with my stethoscope, and also I'll be doing it with my bell. So I'm at the aortic valve, the second intercostal space at the right of the sternum border where S2 is larger than S1. The pulmonic valve, the second intercostal space, the left of the sternum border where S2 is larger than S1. The third intercostal space, the Erb's point, where S1 is equals to S2. The tricuspid valve, no, it's supposed to be here. This is the third intercostal space. The Erb's point, where S1 is equals to S2. Tricuspid valve, the fourth to fifth intercostal space, the the left of the sternum border where S1 is larger than S2, the mitral valve, the mid-clavicular line where S1 is larger than S2. So now, while doing this assessment, I noticed that my patient has a regular heartbeat of 88. And also, I'm going to be using the bell to check also this in normal setting. If I hear the normal sound, what I'm going to do is I'm going to put my patient in the left lateral position, and I'll use the bell to listen to each valve to know where this bell, this sound, this murmur sound is coming out from. If I hear a murmur, I'm going to use the bell and put my patient in the left lateral position, and I will listen to know where the murmur sound is coming from. If my patient's heart rate was irregular, I will use my stethoscope at the base of the heart, and I'll listen for a whole 60 minutes to get what the actual heart rate is. But right now, I don't have to do that because she has irregular heart rate. So now, is there a change in your appetite?
No.
There is no change in your appetite. Okay. When was the last time you had bowel movement?
This morning.
Okay. Are you having nausea or vomiting?
No.
Are you constipated?
No.
Are you throwing up?
No.
Do you have pain anywhere in your abdomen?
No.
Okay. Can you please lie down so that I will check. Now I am inspecting her abdomen. In inspecting, the color of the skin is normal for the ethnicity. The contour is round and it is symmetrical. There is no wound, no dressing, no ileostomy, no colostomy, no Foley at all. So now the next thing I'm going to do is I will be auscultating. I'm going to start with the right lower quadrant, and I'm going to walk myself down. So I'm going to start here, the right lower quadrant, and I'll walk myself down. I'll be auscultating to listen to a sound from 5 to 30 bowel sounds, and for 5 seconds in each quadrant. If I don't hear a sound in a quadrant, I will listen to that quadrant for all 5 minutes to listen to a sound. Also, if she's feeling any pain in any quadrant of her abdomen, that is what I will auscultate last. And also to note, if there is any bulges or any bury sounds or any bulging sounds, I would not auscultate her abdomen so that I don't rupture anything. So now I'm starting from the right lower quadrant, walking myself down. Right upper quadrant, left upper quadrant, left lower quadrant. In checking all this, I noticed there is presence, the bowel sounds are active and they are present. So now the next thing I have to do is I'm going to be palpating. I am doing a light palpation. So in the light palpation, I'm palpating 1 centimeter deep. So if starting from the right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. In my palpation, there is no pain. The next thing I'm going to be doing is I'll be checking if there is any ostomy, ileostomy, if there's any dressing or any Foley. If there is Foley, I will check the urine amount and the quality of the urine to check the color. If she's dehydrated or not, I need to note that so that I'll give her fluid. Then now I'm going to the lower extremities. In going to the lower extremities, the first thing I'm doing is inspection. I'm inspecting that the color is normal for her ethnicity, that there is no edema, that there is an even air distribution. There is no swelling, there is no wound, there is no dressing. I need to check all that because if there is, I need to note it in the patient chart. Now, the next thing I have to be doing is I have to palpate. So, I'm palpating the lower extremities. I'm starting with the temperature. So what I'm going to do is, the temperature of our legs is warm and dry bilaterally. Then the next thing I'm going to be doing is I'm going to be checking the capillary refill. Let me just remove your socks. I'll put it back. The capillary refill, if it came back more than 2 seconds, I'm palpating the pedal pulse and the dorsal pulse, which is strong bilateral like I'm feeling. Then, can you please push forward? Yeah, so can you move up a little bit? Just sit down, please, so that the camera can see you.
Okay.
So this is strong. This is strong. So after I have done that, the muscle strength in the lower extremities is so strong. So everything is good. There is no dressing in here. So now is the chest, the posterior chest. So can you just that side?
Like
Please. Yes. Yeah. So now this is the posterior chest. What I'm going to do first thing is I am inspecting. The color is normal for ethnicity. There is no wound dressing. It is symmetrical. There is alignment of spinal. See, it is symmetrical, the same size. There is an alignment of the spinal process. One place is not like this or like this. Then the next thing we're going to be doing is I'm going to palpating for tenderness and masses. Are you feeling any pain?
No.
If you're feeling any pain, please tell me.
Okay.
So there are no tenderness, there are no masses. Now I'm going to be auscultating using the 8-point sequence. So I'm auscultating so that I can check if there is any wheezing or crackles. Breathe in and out. I'm using the Z-track method. Listening to the inspiratory and expiratory wheeze using the 8-point sequence. The lobe, the right lobe, checking the 2 points. And this, checking the 3 points. While auscultating our posterior chest, I noticed there is a good air entry bilaterally. There are no crackles, no wheezing, nothing, which is very okay. And also, there is no wound dressing at the back. Now, since I've completed my head-to-toe assessment, I'm going to call my doctor and tell him this patient is good and fit for discharge, and everything is working very well. Thank you, and God bless you.